Hi, my name is Jenna Bielman, and this is my Nursing 335 clinical reflection video. The purpose of this video is to see how I met the 8 course objectives throughout the semester. Objective number 1 is to utilize previous knowledge of the science, liberal arts, information technologies, and nursing to develop skills as a nurse leader. I met this objective multiple times throughout this semester by signing up for skills labs to assist fellow learning nursing students. I worked with Nursing 309 students with their video skills as well as assisting them with how to properly fill out a concept map. I also worked with Nursing 321 students on the clinical floor at Lehigh Valley, where I was able to assist them with their clinical skills such as med knowledge, assisting with baths, physical assessments of the patients, and just overall care. I also worked with Nursing 320 students twice, where I was able to enhance their learning on those days by providing practice NCLEX questions and lending a helping hand when needed. I really enjoyed these experiences because I got to show the students everything that I have learned so far in the program, and I was able to provide myself as someone that they could relate to, who's going through the same thing that they are in the same classes that they're going through, and I can pass on the knowledge to them to assist them with furthering their skills and knowledge. Our objective 2 for this semester is to apply basic principles of management to meet the challenge of an ever-changing healthcare environment. For this, I met the objective when I followed around my nurse supervisor. I actually followed around 2, Patty and Eric, at Lehigh Valley Hospital, Cedar Crest. They had both been nurses for years. Eric has his BSN, but Patty only has her RN, and she's 70 years old. Patty had told me that she'd been working at Lehigh Valley Health Network for many years, and when they moved her up to a managerial position. In class, we learned about the term stretching, and this is when you take someone with a skill set and ask them to do more. And this is exactly what Lehigh Valley did with Patty. Even though she didn't have her bachelor's degree, they took into consideration that she had a great amount of skill sets, and they put her up into a managerial position. They also, took into her 40 years of experience into consideration, which really says a lot. When I was following Patty around, you could definitely tell, and she expressed that she is self-aware, that many of the younger nurses think that she's unable to do her job the way that a younger person could just because of her age. And they tend to challenge her opinion a lot, but she remains committed and neutral to her job and helping those other fellow nurses out around her. She also discussed with me how nursing has changed since she's first became a nurse, and how she's keeping up with it by taking computer classes and making sure that, she's up on her computer skills, as well as following evidence-based practice. When I was walking around with Eric, he stated how nurse supervisors share governance, because they can't always be on the floor because they're on so many floors throughout the hospital throughout their shift. So this is where the charge nurse would step in to deal with any issues they can until the new supervisor is available or if needed. He expressed the importance of well-staffing the units and making sure the nurses on the units are ones that are going to lead and encourage others. I did get to see his sheet that has all of the nurses listed in every floor, and when we went to the different units, he would check off that he spoke with them and any complaints that were going on. I recognized that, when I was following Eric, every time we went onto a unit, the nurses would say hi. They're very happy with him. He's very happy with them. He communicates well with them. He's able to carry on a conversation. And you could just tell that he and Patty really value and cherish the interpersonal relationships with the nurses as well as the physicians on the floor that they used to work alongside when they were at the bedside. For objective 3, this is to demonstrate leadership skills through effective use of communication by representing self, the college, and nursing in a professional manner. I met this objective by first dressing appropriately, very clean cut look. My hair was up in a bun that was clean, and the bun was nice and tight, no stringies hanging down. And this just showed them that I was serious about my education, and I made a great first impression for myself and for Cedar Crest College. Another way that I met objective number 3 was through my emails. I sent out those for the course, reaching out to them to just establish when I was going to be there, what time, where I was going to meet them. And when reaching out to these individuals, I addressed myself as, like, hi, my name is Jana Bielman. I'm a senior nursing student here at Cedar Crest College. I am reaching out to you to set up a time to shadow you due to my interest in your field in nursing and my leadership course. I made sure that I sent out thank yous to every single one of my outside experience to really show the gratitude for allowing me to be there with them and see their scope of practice. And I could really tell that they appreciated my professionalism because many of them invited me back to shadow them anytime and even stated that they would put in a good word for me at the facility, or when I was following the nurse practitioner Nicole around at St. Luke's, she even stated that she would email me about setting up a shadowing position in my own spare time with one of the OB nurse practitioners since I want to get into labor and delivery. And that just meant a lot to me because it really showed that I represented myself in the way that others wanted to work with, and that would not only make me, proud and happy, but also Cedar Crest College. So for objective 4, this is critically evaluate and disseminate current research related to the principles of leadership and the effects on healthcare systems. And I met this objective by researching and finding an article that I will share with my clinical group and advisor next Thursday. And it's titled Leadership Behavior of Nurse Managers in Relation to Job Satisfaction and Work Climate. I chose this article because it acknowledges how someone acts while in the managerial position does have an effect on the workers and the satisfaction of them and the work environment that they create for when you're coming into work. This article discusses 2 types of leadership styles, which are a change-oriented leader, and this is described as one is primarily concerned with development and increasing flexibility to gain commitment to the changes, and the other is transformational leader, which focuses on development and change in addition to employee orientation. And while reading Sullivan, we learned about this, and it just describes it as it's the engagement of social interaction, expecting a give and take social, political, and psychosocial benefits. It's to inspire and motivate individuals. And this is super relevant to nursing because nursing has such a high demand job as the occupation. And it's just so imperative to have leaders and a working environment that are compatible with the expectations and the mission statement of the hospital. Or facility. So by having a poor manager and unworkable working environment, this leads to nurse burnouts, quick turnaround times, and which really leads to a decrease in safety on the units for the patients. If nurses are experiencing mental exhaustion and job dissatisfaction, this ultimately leads to not providing patients with the best care possible. Which is why the nurse burnouts, nurse shortages, the quick turnaround times, etc., why it's so important. So, healthcare managers should be aware of how their leadership styles and tones is perceived and how the environment that they create can have a snowball effect. Um, and this study just goes on to show that employees who had managers who were employee oriented and provided a work environment that was open and friendly and ready to learn, had a less turnaround time, less burnout, and better all over patient satisfaction and employee satisfaction. For objective 5, this is function as a competent patient advocate, nurse advocate, and change agent. And I met this through Capitol Hill. We got to see how acting as a nurse advocate really comes into play and the importance of being one for our career as well as for future nurses. We learned that nurses are very underrepresented and we make up most of the workforce, which is really sad if you think about it, that we're so underrepresented. So our first speaker discusses with us on how if nurses don't speak up, nothing is going to change and everything is just going to stay the same. So it's really up to us as nurses to make sure that we are being leaders in our climates, in our environments, workforce, anywhere to make that change. I also worked as a patient advocate when I did the blood pressure clinics. Because the blood pressure clinics allows those who maybe don't have access to getting blood pressures done, or maybe they just don't get them done because they don't know that they should be done and they don't think it's necessary. And the population that I got was generally over the age of 65 years old who had health problems such as heart disease, heart failure, kidney failure, history of heart attacks, etc., which we had learned about in our Nursing 321 class. So I was able to educate these patients the importance of having their blood pressure taken regularly and the importance of exercise and what can affect your blood pressure in a positive and negative way. So I had this one patient who came in and she said that she was worried about her low pulse because she has a history of it, and I told her that anytime she's worried about it to just go to your PCP and ask them to take it, and if she feels that she needs something more definitive of confirming it, I told her that to ask them to do the apical pulse because that's the most reliable due to being able to hear it with your stethoscope. So for objective 6, this is formulate plans for continued personal leadership growth and development as an independent practitioner of nursing and contributing member of society. So for this objective, I attended the evidence-based practice seminar held here at Cedar Crest College, and I was able to learn so much. I learned the importance of evidence-based practice and how it was created. Some of the biggest takeaways from this seminar was to never give up no matter what anyone tells you or how hard it is. Byrne, who was the speaker, she's like the mother of evidence-based practice, and she was able to shed so much light on us of what it took to get evidence-based practice to where it is today. But she wouldn't have been able to get there if she would have stopped every time that she failed. She, as well as the other speakers, just really encouraged us nursing students to further our education and not to stop and to really achieve those goals that we want to achieve no matter what it takes. I learned the importance of having a BSN versus having a diploma or associates, and the benefits of our in-depth education, which I think is so important because when you look at it, patient satisfaction and patient safety is the number one thing. I learned through my also my classmates who shared some of their evidence-based practice projects. I learned so much from them and saw how they're really contributing to not only their education and our education as nurses below them, but really getting the word out there and being able to really dig into it. So I learned as a new nurse that there are many ways that I can contribute to society, such as keeping up with the most current research provided in order to provide my patients with the best care possible. For objective number 7, I recognize the role of nurse in policy making related to healthcare services at local, site, national, and global levels. Again, like I accomplished this through Capitol Hill, where students, we recognized the need to act in order to see the change. And while I was visiting, I was able to advocate for nurses actually with our first speaker. I discussed with him how can those who aren't nurses and don't know what it takes to be a nurse, or what we go through on a day-to-day basis, how can they really fight for what we need? And, don't you think on Capitol Hill we should have more medical professionals fighting for us and being involved and being in legislative, and because they're the ones in the end that really know the things that we go through as medical professionals. And they're super close to the topic, so they'll be able to relate better. And he agreed and stated that that was the best way to get, heard, and that it's important to register and advocate and make sure that your voice is heard. And I believe that this is important because us as nurses really need to stand up for ourselves and fight for what we believe in. And when we had the PSNA personnel talk to us, they just encouraged us again to get out there, vote, for people that are in our state and local, that are really going to make a difference and that connect with us on our political levels. And that the PSNA has been able to pass over 10 bills that for nurses over the years, and has showed the importance of safe staffing, the results that it winds up being better for patient outcomes. And for my final objective, number 8, this is to predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. And an ethical dilemma that I am a huge advocate for is anti-bullying overall, but really in this case for nurses. I have experienced it while on the floor, where I've seen fellow nursing students being talked down to by their preceptors in a very discouraging way, that then affects their ability to work for the rest of the day, and for future on clinicals. So I had the ability to discuss these issues with the nurse supervisor and asked how they deal with these situations, as well as learning in class that, the nurse supervisors address the chain of resolution. So first off, the antagonist and antagonist would discuss the issue on a personal level to see if they can fix it that way. If it doesn't get resolved, then it would head to the head nurse or the charge nurse on the unit. And then if it's still a problem, then it would go to the nurse supervisor, and so on and so forth. And I was educated on the preventative methods that Lehigh Valley has in action, as well as some of the other hospitals. And that's a no tolerance rule, where if someone is bullying another or has incivility towards another, they risk the potential of losing their job or being on probation. And this is just a serious problem in nursing, especially for us new nurses. We need to find a solution, because this was going to result in a mental breakdown and a quick turnover times and decreased patient safety, because you won't feel comfortable asking for help when you need help. And it goes back again that, these nurses who are bullying these younger nurses are not following the ANA Code of Ethics. Because the ANA Code of Ethics discusses this issue in provisions 1, 5, and 6. And it specifically states that the principles of respect for persons extends to all individuals whom with the nurse interacts with. The nurse maintains compassionate and caring relationships with colleagues and others, with a commitment to fair treatment of individuals, for integrity, and compromise and resolving conflicts. So this is just like super important, and I would like to take it upon myself as a future nurse leader to really research this, get the evidence-based practice of what's the best way to deal with it, and go around to hospitals and see what I can do. I really hope you enjoyed what I learned this semester and what I have accomplished, and thanks for watching my video.